Champions of yesteryears. It's such a pleasure to have you all together on this online platform. And without further ado, I will request Professor Amita Pandey to please begin the evening's proceedings.
On behalf of King George's Medical University, Lucknow, India, I extend a warm welcome to all the dignitaries and the esteemed viewers who have joined this meeting both virtually as well as offline today. In this landmark year, as India completes 75 years of independence, we feel that the university must introspect on all it has achieved and, more importantly, look into the future. Keeping this objective in mind, the Medical University decided to reach out to all Honoris Causa of King George's Medical University and seek their guidance in deciding the future path of the university. As we are aware, DSc Honoris Causa is the honorary award for Doctor of Science bestowed upon individuals who have made exceptional contribution to their fields of study. King George Medical University has conferred this prestigious degree on 24 eminent doctors and scientists from across the globe since the year 2005. In fact, the first two recipients of this coveted award were Nobel laureates, Professor Richard Ernst and Professor Kurt Wuthrich, both of whom contributed significantly to the development of nuclear magnetic resonance spectroscopy. So today, we are looking forward to a fruitful discussion with all the dignitaries who have been kind enough to join us today. This meeting would be immensely useful to the Medical University, as all inputs received will be compiled to generate a vision statement for KGMU that would be the guiding force for the next 25 years of this reputed institution. I again welcome you all and would like to formally begin the meeting with a message from our Honorable Chancellor, the Governor of Uttar Pradesh, Srimati Anandiben Patel ji.
किंग जॉर्ज चिकित्सा विश्वविद्यालय के कुलपति लेफ्टिनेंट जनरल डॉक्टर विपिन पुरी जी, विशिष्ट उपाधि ऑनरिस कौसा से अलंकृत चिकित्सकगण, विश्वविद्यालय के चिकित्सकगण, विद्यार्थियों, देवियों और सज्जनों, किंग जॉर्ज चिकित्सा विश्वविद्यालय लखनऊ द्वारा आज़ादी के अमृत महोत्सव वर्ष के अवसर पर विश्वविद्यालय के विगत वर्षों के दीक्षांत समारोह में ऑनरिस कौसा उपाधि से सम्मानित सभी महानुभाव का मैं संस्थान की कुलाधिपति होने के नाते हार्दिक स्वागत करती हूँ। मुझे यह बताया गया है कि किंग जॉर्ज चिकित्सा विश्वविद्यालय द्वारा वर्ष 2005 से वर्तमान तक चिकित्सा जगत के 24 प्रख्यात चिकित्सकों का तथा वैज्ञानिकों का ऑनरियस कौसा की उपाधि से विभूषित किया जा चुका है। यह उपाधि किसी भी चिकित्सा विश्वविद्यालय द्वारा चिकित्सक या वैज्ञानिक को प्रदान की जाने वाली सबसे विशिष्ट उपाधि है। किंग जॉर्ज चिकित्सा विश्वविद्यालय देश के अत्यंत महत्वपूर्ण संस्थानों में से एक है। यह उत्तर प्रदेश राज्य का सबसे प्राचीन चिकित्सा संस्थान है, जो अपने स्थापना काल से ही अनगिनत शिक्षाविद, वैज्ञानिक, अनुसंधानकर्ता, चिकित्सक, प्रशासनिक अधिकारी देकर अपनी क्षमता का परिचय करवाया है। मित्र, इस वर्ष हमने आज़ादी के अमृत महोत्सव पर्व की 75वीं वर्षगांठ पूरे उत्साह से साथ मनाई है। वास्तव में इस अमृत पर्व में शाश्वत भारत की परंपरा, स्वाधीनता संग्राम की परछाई और आज़ाद भारत को गौरवान्वित करने वाली प्रगति शामिल रही है। आज़ादी का ये अमृत पर्व एक अवसर के रूप में हमारी वर्तमान पीढ़ी को मिला है, जो उन्हें प्रतिपल देश के लिए जीने और देश के लिए कुछ करने के लिए प्रेरित कर रहा है। हमें अपने कार्यों के माध्यम से समाज तथा देश के लिए अपना सर्वोत्तम देना होगा, तभी सबका उत्थान होगा। आज आयोजित होने वाली परिचर्चा की थीम 75 years of India's independent KGMU हेडक्वार्टर्स रखी गई है। इस महत्वपूर्ण अवसर पर किंग जॉर्ज चिकित्सा विश्वविद्यालय द्वारा चिकित्सा जगत के महानुभावों के साथ संवाद का आयोजन करना अत्यंत सकारात्मक पहल है। मुझे पूर्ण विश्वास है कि इस आयोजन से चिकित्सा क्षेत्र को आप विद्वानों के ज्ञान एवं अनुभव का लाभ प्राप्त होगा। मुझे यह भी विश्वास है कि बैठक में हुई परिचर्चाएं चिकित्सा की प्रगति तथा भविष्य के स्वास्थ्य, विशेषकर महिलाओं और बालिकाओं के स्वास्थ्य से जुड़ी जन उपयोगी योजनाओं के सुचारू क्रियान्वयन में बहुत उपयोगी सिद्ध होगी। अंत में मैं किंग जॉर्ज चिकित्सा विश्वविद्यालय प्रशासन तथा पूरी टीम को इस आयोजन की सफलता की हार्दिक शुभकामनाएं देती हूँ। जय हिंद। किंग जॉर्ज चिकित्सा विश्वविद्यालय के कुलपति लेफ्टिनेंट जनरल डॉक्टर
As we come back to this meeting once again, this meeting was envisaged by our Honorable Vice Chancellor, Lieutenant General Bipin Puri sir. I will now request him to formally welcome the dignitaries and share the concept behind this meeting with everyone.
Yeah, thank you, Professor Amita. And this is, of course, once again, to all our revered Honoris Cause luminaries of this university. I convey my greetings, my compliments, and respectful gratitude for your presence with us this evening on this online platform. Gentlemen, let me begin by saying that the rich legacy of this college, now a university, has over the years been a medical school of difference, has continued to evolve, adapt, imbibe best practices, and update cutting-edge technology to churn out medical, dental undergrads, PGs, postdoc students, PhDs, besides specialist nurses and paramedical students with a branding comparable to the best in the world. Today, in the 75th year of our country's independence, we decided to introspect on this incredible journey. A journey this institute has lived, relived, and wanted to look at its legendary past, consolidate the gains of a vibrant today, and look through the prismatic lens of the future of our medical university. We stand on a defining moment of our institution's history, and we look up to our mentors, our iconic academicians, and many of you who have left your trail and footprints in the rich legacy of this college. In the next few minutes now, as I take you through the yesterday, the today, and the tomorrow of this college university, I will give you a brief preview and then look up to you for your thoughts, your suggestions, and perhaps a way forward as we continue to build bridges for international collaborations, imbibe and disseminate cutting-edge technology to these students, and make translational research a reality at this institute. So with this introduction, I will move straight into a very small presentation. I take you through the yesterday, the today, and tomorrow of KGMU. So can I share the screen, please, with the audience? Next slide, please. So gentlemen, this is where it is the college university nestled in the capital city of Uttar Pradesh, Lucknow, where we cater for more than 100 million population, more than 5 states adjoining Nepal, all come into our college, into the outpatient as well as are a part of our IPD services. Next slide, please. Historically, it's very fascinating, very intriguing, very interesting. The college, as some of you would remember, was founded in 1905 by the then Prince of Wales, George V. And but actually, the teaching began in 1911. And in those times, the hospital was at Chennai, and the students, they did their medical school here at Lucknow, but went for their hospital training to Chennai. King George Medical University, now called as such, aspires, ladies and gentlemen, to be amongst the best medical institution in Asia. Built, as you can see, in this Indo-Saracenic architectural style buildings, amalgamation of the European science and the native art of traditional Hindu forms and modern functions, is really a marvel, which is at the pride of not only of the state, but also of the country. Next slide, please. Can we play this video? Ladies and gentlemen, as you can see, this video takes you back from the time of World War I, when the first batch of doctors from King George Medical College were involved in treating many of these patients who were struck down by the Spanish flu. And historically, we have these pictures, we have these videos as the first batch of, so I think with COVID, we were reliving another experience which happened more than 100 years ago. As far as the college university rankings are concerned, as you can see, we got 5 years ago, we got an A grading from the NAC, which now is due for its reaffirmation. And as we stand today, maybe in the next month or so, the NAC team will be visiting us to review this and look at the second cycle and see how and where we stand today. As far as the national rankings are concerned, 11th best as far as the nerve is concerned, 5th best as far as the dental is concerned, consistently nearly in the top 10 medical institutes of the country since the past so many years. This year, in 2022, India Today gave us the 3rd position, and Outlook gave us the 4th best medical college in the country. Slide, please. Well, one of the largest hospitals of India is amazing, 77 basic and super specialty services available in this hospital with a bed strength of more than 4,000 beds. The Gandhi Memorial and Associated Hospital, which is inside the main campus, is spread over an area of about 88,000 square meters. So as you can see, it's more horizontally aligned than vertically, which has been the emphasis in recent times. Besides this, now what has happened is, what has evolved over a period of time is these vertically aligned buildings and the super specialty complex, that is the Shatabdi complex, which has come up, the phase 1 and phase 2, a new bone, joint and rehabilitation complex, what we call as the RALC hospital, has come up. There is, of course, the Queen Mary Hospital, which looks after obstetrics and gynecology, a geriatric and mental health and psychiatry building, which is separate, and then is cardiology, a Lari cardiology complex, which is yet again a separate standard building. Just a list of all the possible specialties and super specialties, just to give you a bird's eye view of what it's all about. Slide, please. Just to give you also an idea of our OPD and our IPD services, about 10,000 per day is the footfall in the outpatient, and nearly about 400 to 500 patients are getting admitted every day. So that's the amount of the workload that we're talking about, with a bed occupancy of nearly 90 to 95%. Very pleased to share with you that the trauma center at KGMU has now been labeled as a level 1 trauma center. And that is perhaps because, not only because of the volume that we take on, but also the amount of training, the amount of the vigorous programs that we are running, not only for the college, but also for the entire state, as far as BLS, ATLS training is concerned, and also trying to extend, as you can see, we are talking about trauma prevention now, and we have now collaborated with the UP government and have tried to emphasize how important it is to reach out to provide pre-hospital care. And that is something which we are now looking at, how we could interact, collaborate with the government, collaborate with the traffic police, and reach out to at least a radius of about 5 kilometers from KGMU and provide pre-hospital care in an attempt to decrease morbidity and mortality and do limb and life salvage as far as in our part of the city and district is concerned. Slide, please. We have also, as a part of our outreach services, moved out to 10 villages around Lucknow. We have adopted these villages. We are taking care of our rural health training centers, which again is a mandate, a responsibility which has been given to us. So we, as you can see, besides the workload that we have at KGMU, we are also taking care of these OPD services in these rural centers, where not only are we doing obstetrics and gynecology, but we're also doing specialty clinics in medicine, pediatrics, psychiatric, and dentistry. So, so such is volume, not only in the hospital complex, but also in the rural setting. A word about the patient clientele that we look at. The government of Uttar Pradesh has earmarked us as one of the largest provider of healthcare, especially to the economically weaker section of society. And towards this goal and objective, there are so many of these Ayushman patients, the schemes which we are trying to effectively utilize and reach out to the beneficiaries. In fact, of the last 2 years, we've been labeled as the #1 position as far as Ayushman rollout is concerned in the state of Uttar Pradesh. There are also this below poverty line, the Antodaya and the Vipan and destitute patients. They're all people who have very low income, and the government asks us to certify this certification of these individuals and provide them free medical aid. Besides, of course, Asadhya, which is for patients who have cancer, chronic kidney and heart disease, is yet another subset of patients where we provide free medical care as a part of government policy of government of Uttar Pradesh. A word about how over a period of time, this college university has built up its services in terms of its diagnostic capability, be it pathology services, as you can see, histopath, immunolab, hematology, lymphoma, leukemia lab, microbiology, they have it all, virology, mycology, bacteriology, parasitology, biochemistry, including toxicology and heavy metals, and radiodiagnosis, ultrasound, CT, MRI, CBCT, and now, of course, a PET scan, which would be perhaps be rolled out in the next couple of weeks. Very, very pleased to share that our laboratory, the microbiology laboratory, has NABL accreditation. We're very, very proud, but validation, accreditation of all the laboratories, the including the histopathology, is above board, and we are very, very proud. And in fact, we are leading the way as far as the entire state of Uttar Pradesh is concerned. Slide, please. A word about various state-of-the-art centers that we have. So let me first talk about the state referral centers as far as TB diagnosis, hepatitis testing, rehab centers, as far as we have the only limb center in the state of Uttar Pradesh, the artificial limb center I'm talking about, retroviral and other STD testing. We train the entire state, and besides, of course, virology center, which is again sponsored, of course, by the ICMR and the Department of Health and Research. So, so much so as far as the state referral center is concerned. A word about various centers of excellence that we take great pride in talking about is the ICMR Advanced Clinical Trial Center, the National Cancer Registry, the Antiretroviral Therapy Center, the NICUs. We boast of a state-of-the-art NICU, a WHO Nodal Center for Vaccine Preventable Disease Testing, Advanced Mycology Diagnostic Center, and a Cochrane India Network Affiliate Center, a little bit about which I shall be talking in the next slide. Next slide, please. Just a preview of research and innovation. As many of you are aware, we have given medical research a great impetus and a push as far as this college university is concerned. We were made as one of the Cochrane India affiliate centers, one of the 8 centers in India, and very proud to be one of the centers. And as you can see, the list of publications, Scopus, PubMed, we haven't got the list of the Web of Science, but just for 21, in the year 2021, in Scopus, we had 672 and 828 publications in PubMed. Just also to mention that 2% of our faculty have ranked in the leading researchers as per the Stanford University rankings in the year 2021. Very, very pleased to talk about the Center of Precision Medicine and Healthcare, the first of its kind in the country. And I once again thank Professor Dhaven, who has been instrumental in helping us to set up this Center for Precision Medicine and Healthcare, and try and use it for the advantage of our patient clientele. And I once again thought it important to make a mention of this. The Department of Biotechnology, Government of India, KGMU, Lucknow, and IIT Kanpur have now collaborated to form what is called as the School of International Biodesign, wherein there is a synergy of healthcare innovation and entrepreneurship. And I'm very, very glad to talk about a gentleman that Professor Rishi Sethi, who is a professor in the Department of Cardiology, is heading this team from KGMU, and with collaboration with IIT Kanpur, this program is taking off now in the latter part of this year. And we have already got the first list of fellows who have joined us at KGMU, who are going to be here trying to understand and perceive what exactly are the requirements in terms of engineering research, which would then happen at IIT Kanpur, and they would then be moving up for a few months here at KGMU, and then go back to Kanpur, and then come back and see how best we can take these engineering patents forward and try and collaborate to the best advantage as far as this healthcare innovations is concerned. Next slide, please. A word about the faculty. As you're aware, we have more than about 500 faculty members in this university, nearly about 700 junior doctors, nearly about 9,000 staff here at this university, where we churn out nearly about 250 students every year, about 272 MD, MS students, about 56 odd postdoctoral students, and about 60 masters in hospital administration. 70 students in BDS, about 43 in the masters in dental sciences. BSc nursing, about 100 students, 25 students in MSc nursing, and diploma, BTech and diploma. This is, I'm talking about the paramedical, nearly about 440 students do their degree stroke diploma courses in paramedical sciences. So that's the volume that we are churning out on a yearly basis. Very, very proud to talk about our alumni. As you can see, we have multiple Padma awardees, 26 awardees, as you can see, Padma Shri, 6 awardees in Padma Bhushan, 1 awardee with Padma Bhushan and 1 Padma Vibhushan. And many of our alumni have been decorated with very the highest civilian awards. They have many of them have occupied many of these very important chairs, including President, Medical Council of India, Vice Chancellors of various universities across the length and breadth of the country. Many of them I have been personally interacting as generals in the Armed Forces Medical Services, Director General of the Central Health Services, Secretary, Medical Council of India, directors, general, as far as Uttar Pradesh is concerned, I'm talking the health services, UP, Director AIMS, Director SGPGI. In fact, the present Director SGPGI is a Georgian. Several thousand eminent alumni serving in pivotal posts in the US, UK, Australia. Some of them are here today in this audience, and we are so proud on each and every one of you. Thank you. Next slide, please. Well, gentlemen, let me say this about technology. We have taken on to technology in a big way in this university, and have tried to establish the entire network. In fact, if you see the entire network today, the campus is Wi-Fi enabled. We have tried to push in a latest firewall and do as per and make it a more IT enabled university. We are now also connected to the National Knowledge Network, which is the Government of India sponsored university program. In early this year, we started the first community radio station called as KGMU Goonj 89.6 FM. And it is now rolling out from health advisories, interactions, talks from various luminaries from not only from this college, but also from iconic figures all over the country. And it is a pleasure. And now this KGMU Goonj is reaching out to across the world, because it is now available on apps, on applications. And by these applications, you can actually, even in the US and the UK, you would have access to KGMU Goonj. Let me talk about a word about COVID care. Gentlemen, let me say this, that COVID care, we are very, very proud to talk about this. We started this 1,000 COVID care beds, which is one of the largest multi-speciality COVID hospital here in the state of Uttar Pradesh. And we had, and that included the works, including the ICU facilities, dialysis, operation theater, pediatric care, obstetric care, etc., etc. So we had it all in one roof. And what we actually did was that the orthopedic wing, which is a standalone, was vacated, and the entire COVID hospital actually moved in there. And we were the first laboratory to start testing in the state of Uttar Pradesh for the RT-PCR. And as we talk today, we have done more than 40 lakh RT-PCR tests in a single institution, which perhaps is the largest by any single institution in the country. ICMR made us a center of excellence for COVID testing and diagnostics, and we then moved in the entire state of Uttar Pradesh to set up multiple RT-PCR laboratories all over the state of Uttar Pradesh, and we continue to monitor them for the last. We have continued to monitor them for the last 2 years or so. We have treated, as you can see, more than 10,000 COVID patients. Digital consultations for more than 350,000 patients. Vaccination drive, of course, again, is also ongoing. And perhaps, again, one of the largest mucormycosis series that we saw was about more than 500 cases of mucormycosis at the peak of this second wave. A word about laboratory services. As I mentioned, we started this concept of pool testing because of the huge volumes that we were getting. It was impossible to churn out results, and we started this concept of pool testing. And in case one large pool was negative, we knew that we didn't have to do anything. But in case the pool was positive, then we would do every one of them. And this is how it was. We now, of course, boast of a BSL-3 facility that we have at KGMU. And the Honorable Chief Minister of Uttar Pradesh has asked us to look at setting up a BSL-4, which would be under the ambit of KGMU. So as I said, more than 60,000 samples were done in 3 sero-surveillance studies which were requested to us by the government of Uttar Pradesh to look at herd immunity and look at where do we stand in terms of herd immunity. And that is something which the government of Uttar Pradesh now boasts of as we built up the herd immunity of the state of Uttar Pradesh. As I said, trained more than 200 RT-PCR labs through structured training programs. And the ICMR, of course, gave us this title of Center of Excellence as far as the microbiology services was concerned. We started this high throughput COVID-19 laboratory, and of course, just a glimpse of our BSL-3 facility. Slide, please. Well, what we propose, what we plan as of talk today, there are proposals which we have moved to the government for some centers of excellence that we want in surgery, in the various medicine and surgical subspecialties, and we have located the land, we have moved this proposal with the government, and we hope in the near future we possibly would get this land for establishing these centers of excellence. Establishment of state-of-the-art infectious disease hospital at KGMU. Now this was, we thought, a felt need, because otherwise, if we have to face another pandemic or another similar sort of infectious disease problem, it becomes so difficult to vacate existing patients in existing centers. So therefore, this proposal is also now being asked for by the government, and we are pleased to take this forward. Establishment an Institute of Women Health at KGMU. As some of you would remember, there is an area just adjoining the present Queen Mary Hospital, which is there has been a land encroachment by these shopkeepers for the last about 50 years. We seem to have won the case in court, and hopefully, if we get this land, which I hope we will, the plan would be to make a state-of-the-art Institute of Women Health with the various subspecialties in adolescent health, gynae oncology, infertility, etc., etc. A new state-of-the-art dental sciences building is also in the offing, which the land has been defined, has been this thing, and hopefully that should also come up in the very near future. Renovation of various hostels was a considered necessity, because many of these hostels, as you're aware, we have nearly about 22 hostels, and many of them are not in a very good state of repair, and therefore a need was felt for renovation of these hostels. We have moved with the government, and of course, though I'm not sure how quickly this will be possible, but it is going to be one area which I feel must be given an impetus and a push, so that we can ensure that our children are the new generation of doctors, the training doctors, the students, the residents are given a decent place to live in. And I think this is something which we are wanting to give an impetus and push. A separate building for our medical emergencies. As I mentioned, ladies and gentlemen, we have a single building, what we call as a trauma center, which takes on not only road traffic accidents and injuries, but also caters for all the medical emergencies. We have now decided that we must have a separate building, a standalone building for trauma, as it exists in Delhi, as far as the AIMS Trauma Center is concerned. On the same setting, we would want a separate for trauma and a separate building, a standalone for medical emergencies. A need for parking has been felt for many, many years in the campus because of as things have mushroomed, as with increasing faculty, increasing volume of patients, their attendance, many patients coming in very critical conditions in ambulances, vehicles. There is an overcrowding of sorts as far as the college campus is concerned, and therefore a need for a multi-level parking, and that has been expressed to the government, and this is again has been taken on a fast forward mode. Cashless and paperless transaction is the need of the hour. We are indeed trying to imbibe the policy of digital India and try and take this imbibe as many as positives from this, and we have already initiated many innovations as far as the cashless transactions are concerned, as far as the paperless transactions are concerned, and we hopefully in the next few years there would be a difference as far as this pointer is concerned as well. Well, my last slide, as I come to a visionary, some sort of a vision that I have, and we now look up to you all for your help and your inputs. We have tried, as far as the governance is concerned, we have tried to make the governance participatory by consensus, making everybody accountable, transparent, responsive, effective and efficient, equitable and inclusive. So this, I mean, you might think that these are all adjectives, but I mean every word what has been written in letter and spirit. And I have tried to imbibe this. I bring with me values which are from the armed forces, and I have tried to imbibe every bit of this in this college as well. As far as medical education is concerned, I think competency and skill-based medical training program is going to be very important, and we have to take on what the National Medical Commission has suggested as far as the education program is concerned. Networking nationally and internationally, global interaction, collaboration, I think is a mandate that we have to embrace, and we are not shying off from doing this, because it is important that we do this for the best advantage of our students and for the faculty. Social outreach, as I always say, reaching out to the last mile. It is very important to reach out to population at large in the area of our responsibility. And we have tried to do this, as I mentioned, by reaching out to the adopted villages and trying and doing our best, even in the rural setting is concerned. Carbon footprints, we, as the college university subscribes to this thought process, we are looking at increasing our solar panels. We are trying to decrease our energy consumptions, using as energy efficient equipment is concerned, looking at various other carbon footprints for sustainable development, environmental, various measures, whether we have gone through this energy audit, we have done this green audit, and we are looking at various other measures by which we could decrease our carbon footprints and be more inclusive as far as the country's policy is concerned. Research and innovation, very happy once again to talk about precision medicine and imbibing translational medicine from bench to bedside would be an endeavor, and we would want to push this as far as this is concerned. And of course, clinical care, we would be looking at grassroots level for sustained healthcare benefits, and of course, look at medical tourism. We get so many patients from Nepal. We are more than happy to take on to any other medical tourism as might come to us in due course of time. Friends, ladies and gentlemen, a vision, a mission, some values I have talked about in the last few minutes. We don't know where we are. I know that we are in crossroads. We are in a very defining moment in our college, our university's history. And with these few words, I would want to conclude this journey of positivity and progress, as we have evolved from what we were for 115 years ago and what we are today. And but the next 25 years, it is now we look at the next 25 years. How do we plan? How do we strategize? How do we conceptualize? What should be our short-term goals? What should be our mid-term goals? And how do we take this forward? With these few words, once again, thank you, ladies and gentlemen, for your attention.
Thank you very much, sir, for sharing the concept behind this meeting with everybody. And as we move ahead, it is an honor and privilege to welcome Professor Stephen G. Bowen from the Division of Surgery and Interventional Science, University College London today. Professor Bowen was decorated with the Honoris Cause from KGMU in the year 2014. He is credited with the development of optical techniques, including elastic shuttering, spectroscopy for detection of precancerous changes in tissues, and is a pioneer in translational research in the use of laser for minimally invasive treatment of cancers. An avid researcher, he has supervised several landmark research projects on lasers, and today he would be enlightening us with his talk on the use of laser in medicinal surgery. Professor Stephen Bowen, sir.
Can you hear me now?
Yes, sir.
Yes, sir.
Thank you for that kind introduction. It was an enormous pleasure to come to Lucknow in 2014 with Dr. Shah, and a great honor to be asked to talk again today. Well, my professional career has centered largely on the application of lasers in medicine. So what I'd like to do this afternoon is just give you a brief overview of use of lasers in medicine, and then we'll be happy to enjoy a discussion. Now, for most people from my generation, the first time they would have heard of lasers was from this James Bond movie, where James Bond was threatened with a laser attack. But now it's much more science. Let us look for a moment at potential role of light in medicine. Of course, ordinary light sources are important for looking in dark places like endoscopy, and also for analysis of optical signals, as you mentioned in the introduction, for detecting premalignant changes before they're macroscopically obvious. But in terms of treatment, lasers have far more to offer than many other forms of light. Just very quickly, it's light of a single color, easy to control. You can focus it on a small area, like the end of flexible fibers, and you can turn the power up quite a lot. Biologically, the effects can be mechanical, thermal, and photomechanical. Well, I'm going to give you some examples of each, but we start with the mechanical ones. Well, one of the earliest applications was in ophthalmic surgery, particularly for the treatment of diabetic retinopathy. And here's an example of how it works in principle. Multiple small laser shots are made on the retina. On the picture on the right, this is a real case. And the idea is to reduce the oxygen demand. But the one that's become most established is the laser-assisted in situ keratomyolusis, where the laser is used to reshape the cornea to reduce the necessary for spectacles. And the way this is done, it's a very simple surgical procedure. The conjunctiva is lifted, and then the laser is programmed to reshape the lens as required. And it's all done in a very short time span. Power, shock waves in lasers. Sometimes you get a posterior membrane ablation, some difficulty after surgery with replacing it, and pulse lasers, because you can focus them on the membrane behind the new lens. That's diffuse on the retina, so it doesn't do any harm there, but short, sharp shots can relieve this obstruction. Pulse lasers can also be used for cracking hard tissues in the presence of soft ones. You can crack the outside shell of an egg. You do it on kidney stones here, so stones can be reduced to rubble and pass in the urine with application endoscopically. Well, what got me into lasers as a gastroenterologist was the way of treating hemorrhage from peptic ulcers. And we spent several years finding out how to do this. First, the challenge was, what mechanism do you want in a stomach to stop it bleeding? And the answer is basically thermal contraction. And you can see this example of cooking bacon, 3 slices from the same pack. As you heat it, it shrinks. And that's what's required for hemostasis. But this required a lot of experiments, from laboratory experiments on old animal tissue to shots on living tissue to show contraction of vessels, and then playing with different lasers to find the one that gave the most effective hemostasis. Having done that in the laboratory, we needed to understand which ulcers that bled actually need endoscopic measurements, hemostasis, and which will stop on their own. And here you have an example on what one has to do. Here is the laser fiber. This red is an aiming beam. And you put a series of shots around the bleeding vessel. It shrinks that tissue around the vessel with resulting hemostasis. And this was actually the first technique that was used endoscopically to stop peptic ulcers bleeding. And you see there was a controlled trial here. 10% of those rebled after laser, but nearly 30%, or nearly 40% of those who did not have any endoscopic treatment. This was the first randomized study that showed that hemorrhage from peptic ulcers could be controlled endoscopically. Now, this was really the origin of the National Medical Laser Center, which shown that we could go from animals to patients to established clinical treatments. And the philosophy of the center was to understand how light can interact with living tissue in a more general way, and how those effects can be used in the detection, diagnosis, and treatment of human disease. Now, when we got beyond the ulcers, the next challenge was to use lasers to actually destroy tissue. And the first one was obstructing advanced cancers of hollow organs. And this example is an advanced esophageal cancer causing severe dysphagia, and what it looks like after the laser. And the beauty of the laser is that it gets coagulation of the underlying tissue so that you can bore your hole through a hemorrhagic tumor and get hemostasis at the same time. And there's a barium swallow before and after. Now, at this time, our colleagues in respiratory medicine said, well, why can't we do the same in advanced bronchial cancers? This is more difficult because of the danger of causing worsening obstruction of a major airway. But here is an example of, I'm sorry about this, a major carinal carcinoma that is completely blocking one main bronchus and partially obstructing the other, but it can be opened up with the laser. And there's a collapsed lung, re-expanded after laser. And this is what it did with the peak flow. Dramatic improvement. And now these recanalation palliations in both the GI tract and the major airways has become routine. Now we move on to more advanced techniques for lasers and cancer therapy. There are really three main groups of treatments for cancer. First, the ones I've shown you, which are the high power thermal ones, blasting a passage through advanced cancers. Effective for palliation, but basically crude. The next power is a simple thermal technique, gentle cooking to destroy tumors in solid organs. And the last one is a photochemical one in which no heat is involved. But let's look at the low power thermal techniques first. The idea is that you can insert a needle into a solid tumor, pass a laser fiber through that, pull the needle back so that the laser fiber can deliver energy directly to the center of a solid organ. And this is what it looks like in experimental techniques. 4 laser lesions in the liver, the sharp cutoff between that and untreated tissue at the side. Now, we've worked on a lot of applications for this. This was the first one, anecdotally, a cutaneous secondary, just to show that the technique was safe. But this is one of the first ones for actually treating a patient, an isolated metastasis from a colonic carcinoma. And you see it's relatively simple to sedation, local anesthetic, needles into the tumor under ultrasound guidance, and laser fibers pass through these needles. And there you have this isolated secondary and what it looks like a couple of days after treatment. Now, this is very simple. It's very safe. It can be applied in a series of other organs. Here's an isolated peripheral metastasis in the lung. Here's the metastasis. Here are the needles going in. It's almost gone on the 1-day follow-up. And after a few months, all the dead tissue has been reabsorbed. We've also used this on the breast. Of course, in many cases, surgery is a better option for the breast. But you can see this is a small primary carcinoma, and this is what it looks like a few days after laser treatment. It's also very convenient for benign fibroadenomas of the breast. What young woman wants a scar in her breast if fibroadenoma can be treated just by a few needles? The treatment is very simple. This is a desktop laser. This is a routine ultrasound. This is a fiber shown in the tumor. And if you follow these patients through, as over a period of quite long, which can be several months, the dead tissue in the fibroadenoma is reabsorbed and the patient becomes symptomatic. Exactly the same can be done with fibroids of the uterus, a little more complicated because it requires a laparoscopy. And then you can follow the process of the fibroid here as it shrinks away over a period of months. And these are potentially simple, safe, and relatively cheap procedures. Now let me turn on to my main research focus, which has actually been on photodynamic therapy for many years. And this is where we use a combination of a photosensitizing drug, which is activated by light of a specific wavelength, which is usually a laser, but I will show you how it doesn't have to be a laser, and oxygen as well. You give the photosensitizing drug, you wait for it to localize where you want, which be from minutes to days, and then you activate it in that site. And there's very little effect where there is no light, although you may have to protect the skin. Now, PDT has become most established for skin conditions. And here are 2 examples of Bowen's disease, which is a precancerous condition, very difficult to treat in areas where the skin is directly overlying bone. But because PDT protects connective tissue like collagen, you can treat the neoplastic cells and it'll heal up by regeneration on the structural collagen that is not damaged. And you can see these dramatic results, one on a finger and one on an old lady's shin. Now, this is one of the attractions of PDT, that when you treat normal tissues, many of them heal up by regeneration rather than scarring. And this is 2 small cancers on the lips. Now, a few days after treatment, it looks a bit of a mess. But when it's given a chance to heal up, the only remaining evidence is a small scar. Now, this, I believe, is a treatment that has a big future. And I have been involved in a major program together with Harvard in Boston and with the Aligarh Muslim University just down the road from you in Uttar Pradesh. And what this has been is low-cost technology for image-guided PDT of oral cancer. And one of the main attractions of this is we don't use a laser, but the ingenious team at the University of Massachusetts have devised a LED-operated laser, but the light can be transmitted down a flexible fiber. And this, as you can see, how it's applied in the treatment of early oral cancers. These are T1, N0, M0 cancers. This on the bottom left-hand corner is the actual light source. And you can see the cost is around $500. This is only a provisional one. And that's at no more than 10% of what a comparable laser would cost, probably even reduced below that. Now, the other attraction of this program is that using the photosensitizing ALA, this fluoresces in malignant areas. And we devised modification to a mobile phone so that you can activate the fluorescence to determine the limits of these early cancers. And this red area in the middle is glowing brighter than the surroundings. And that was only fluorescing after the administration of the photosensitizer. So this way, we've got a technique for delineating the cancer, as well as just the oral observation, delivering light to it, and we've had very satisfactory results. Only 30 patients treated, but of 22, the tumor was eradicated with no evidence of recurrence over a follow-up period of up to 3 years. Now, I want to distinguish between what happens if you treat tumors with a thermal laser, so the heat is just delivered into the center of the organ of interest. With PDT, you again use a laser to deliver light to the center of the tissue being treated, but there's no tissue healing, and hence the effect is photochemical. You get a chemical change, and this is why tissues heal so well, because the collagen is preserved. Lasers are used particularly for PDT is used provisionally for superficial lesions. And of course, that's why things like the skin and the early oral cancers heal so well. But we have also used PDT for more invasive cancers. This is an example to illustrate the difference between the thermal laser and the PDT. Of course, the PDT laser is much lower powered, so there's no heat involved. These are normal pig lungs in which there's been a zone of necrosis of comparable extent in a lung treated with heat, and you can see all the treated area has been destroyed, and there's really no functional tissue there. But here with PDT, the volume of necrosis in terms of destroying the alveoli was very similar to the thermal one. But when it's given a chance to heal up, you can see the major structures are preserved, the major vessels and the major airways. So you can treat a tumor in the middle of the lung and expect the tissue peripheral to that to heal up. Now, these experiments were done many years ago, but it always disappoints me that not many people have taken this up clinically. But this is something that I think could be developed. Cancer of the pancreas, as a gastroenterologist, has been a particular interest of mine. Of course, pancreatic cancers are very difficult to treat, but as far as we've got so far is to show that here we have a cancer in the pancreas treated by PDT with the needles through the abdominal wall. And this is what it looks like a few days later, contrast enhanced CT, and we have area of necrosis. But because of the preservation of the connective tissue, this area does not fall apart. So we don't have any fistulae. So it makes it considerably safer than using a thermal laser in that sort of situation. The prostate one, we've done similar sorts of things. And here the idea is to use a technique as an alternative to focal treatment of cancer in the prostate, as an alternative to radical surgery or radical therapy, which both have the risks of impotence or incontinence. And here a tumor has been localized by multiple biopsies. This is the scan before treatment, and after treatment, you've got this area of devascularization, which is a PDT necrosis. Now, this is actually being approved by the European Medical Agency as a licensed treatment, only for small areas at the moment, but there is potential for this being expanded as it can be repeated as required, which is not true of radical surgery or radiotherapy. So these are new ideas on the role. Now, the last one I want to talk about is photodynamic therapy and arterial disease, which is another one that might be of interest to the groups in Lucknow. Now, you'll see at the bottom, you're all familiar with angioplasty, balloon angioplasty for opening up occluded arteries. Now, that's all very well. It works very well for opening obstructions, but many of these arteries close up again afterwards, at least partly due to interstitial hyperplasia of the medial smooth muscle. And that is why stents are included after the angioplasty. But what we did was to see what happened to arteries if you treat them with PDT. And if you look at a conventional artery here, untreated artery, and a PDT treated one, you see that all the smooth muscle cells and the endothelium have been destroyed. But following those up, there was no alteration of the function of the artery. Endothelial cells are regenerated quite quickly, smooth muscle cells hardly at all. But the point was that the artery did not occlude afterwards. And this went into clinical trials. And here is an example. This is a femoral artery stenosis that has been previously treated by an angioplasty, but this stenosis has recurred within 6 months. So this was a repeat angioplasty here with the wire going through and after dilatation. Oh, and I'm sorry, the overlying pictures, I can't show you what the final result was. Oh yeah, 2 years later, you'll see that the artery stayed open again because of the PDT that had given as an adjuvant. Given at the time of the angioplasty, you give the sensitizer before the balloon, and then you replace the wire guiding the balloon through with a laser fiber, and then you can deliver light at the same procedure. So there's no more trauma to the patient, and you have this prospect of a long-standing, persistent dilatation of the vessel without the need to put a stent in. This needs to be subjected to a major clinical trial, but it has potential of saving the cost of stents and may also be applicable in stents that are the wrong shape in terms of any bends or too many problems associated with the stent, like there is stenosis. So I just want to summarize this. I just put this back out of the field of view. What can we expect to do with minimally invasive laser therapy? Of course, the aim is to treat diseased tissue wherever it is in the body with minimal effects on the surrounding normal tissue. But the challenge is you must know the full extent of the disease you're trying to treat, which means that you need excellent imaging to go with these approaches. You must match the extent of your treatment to the extent of disease, and you must ensure that all the treated areas heal safely. Now, of course, there are many other techniques that are being used for image-guided therapy, but the novelty of lasers really started all this off. And though now we may use radiofrequency ablation, microwaves, and various other things, the concept of sticking a laser fiber into tissue and treating something in the middle of a solid organ really started with this and has expanded to many other things. Although in many cases now the laser is not the primary energy source that's used. And of course, the value of this approach is if you can do things with minimal intervention, minimal invasion, you're going to have fewer complications, a more rapid healing time. So that's going to save in costs, save in hospital bed time, and is more cost effective. Sure, you have to buy 1 or 2 lasers to do this, but they last for many years. But when you have to use stents and other things that you leave inside, there are one-offs. So I hope that's given you a feel of what can go on. There wasn't time to put all those in context with all the other treatments, but I would like to stress The laser treatment can be very precise, but you must get it right. If you overtreat it, you have the potential for running into all sorts of problems. And if you undertreat, of course, you're not going to disease. So just a cartoon to show you must get your dosimetry right, whether it's just the thermal laser or whether it's that of the photosensitizer as well. But if you do, I think PDT has a good future. It's been around a long time, but the interest is steadily increasing. So I just include that by saying a special thank you to Lucknow, to Professor Ravi Kant, who was a very old friend ever since he spent a year with us in London back in the 1990s. And of course, it was delightful to see him and come to the ceremony in Lucknow in 2014. So thank you very much for all you've done. I think it's been very great to collaborate with you. Maybe the way of continuing that in some ways. Thank you very much. Everybody else seems to be muted, so I...
Surgeon of international repute. He's a recipient of the coveted Dr. B.C. Roy Award, Padam Shri, and Padam Bhushan, and was conferred the Honoris Causa by KGMU in the year 2007. Today, he would be speaking on KGMC and beyond. So over to you, sir. He's muted.
Please unmute.
Sir, please unmute yourself.
Sorry. Okay. I said it's overwhelming to be on the panel with such luminaries. Most of them are my predecessors at KGMC, and now it's a very proud moment to have heard General Puri to have narrated the journey from KGMC to KGMU. In the middle, of course, there were many iterations of Sahu, Maharaj and all that business, but I'm so glad it is now KGMU. So my compliments to all of you who have taken this journey to so far. So personally, I remember the first day I came to KGMC, and when I was crossing the bridge on Gomti to go to the TG hostel, there was ragging going on the bridge. And of course, you are all familiar with the old term. I suppose it still exists, dear. So I was with my old doll on the rickshaw, and the senior called me off, get off the rickshaw, and he asked me a very quick question as soon as I got off. And he said, "Tumhari jaat kya hai?" So I said, "Punjabi." So the guy gave me one whack, which I still remember. Nobody has ever slapped me in my life except that day. That senior was so incensed with the fact that I said Punjabi was a jaat. So that was an education for me, where my whole medical profession started. So I never knew what, coming from Delhi, we didn't have any knowledge of what castes are, but that was a good thing. So I would say my growing up happened in KGMC. That was the first day. Anyway, of course, we got great education. We had great teachers. There were professors like Mehdi Hassan, who was our anatomy teacher, who the ossification centers, he taught us then. I still remember verbatim. And then there were, I think most of them are not here anymore, but Dr. Mansoor Hassan is still around, and I do be in touch with him, and he's taught us cardiology the way it existed at that time, because he just returned from England and he had that swagger. So I remember very fond memories of our growing through the different stages at KGMU. My growing up happened on one night. In those days, people with mitral stenosis, so this was this lady, young lady, who had severe mitral stenosis. And we as senior students were given a 4-hour duty by the bedside. And all we were doing was, through a microcatheter, re-infusing the acidic fluid into the external jugular vein with the help of this rotating pump. And we had 4-hour duties on rotating the pump. Now, we knew very well this was going to do very little for her and she was going to die anyway. But we had those 4 hours of actually getting out of ourselves and thinking that, look, what kind of doctors are we going to be? In India, these people, we know what the problem is, but we don't know how to fix it. That's how the whole bug of becoming a heart surgeon started in me from that night. Then, of course, I pursued from the journals. We were thinking, look, there is development of mitral valve surgery happening in America as we were there at KGMU. Landed up at NYU, where Dr. Frank Spencer was considered one of the 3 pioneers of coronary bypass surgery and heart surgery. Fortunately got in. But the reason why we got in of our education at KGMU, or KGMC then, because it had equipped us with such great ability to do clinical diagnosis. And you know, when I started, there were 32 residents. Dr. Jatin Shah, I'm sure, has been even ahead of me. He's been through all that. Out of the 32, 2 were going to make it to heart surgery. And I tell you, at every stage, the grounding we got in our anatomy, physiology, surgery, medicine, actually held us in great stead. So I salute the institution always. And some time ago, many years ago, I made a very small contribution in my mother's name to the library. I don't know if it's still there or not. But that is something that was an emotion. And then I had also sworn when I left, this was in 1968, that I would do something for Lucknow, just because it was my professional birthplace. 40 years later, we opened as the Medanta Institute. As you know, Medanta, the Medicity on Shahid Path. So it is a total tribute to my journey from KGMC to now. And actually, I'm glad you invited me along with my colleagues, senior colleagues, that General Puri's presentation has actually given us, at least me, a new dynamics of where you're taking the university. So I think with that presentation, you've thought of everything. But there are 2 things from our side that I would like to say. One of the things that we learned in our journey in the US, and I was at New York University in New York, and my professional father was Dr. Frank Spencer. He's unfortunately not there anymore, but he taught us 2 things. And he said, if you are standing still, you are going backwards. And if you are not better today than yesterday, you actually wasted 24 hours. And that rings in my head, and I always tell my own students and colleagues that really life and medicine is such a dynamic field that if we don't move with the speed of the development that is happening around us, we are actually missing the bus. So 2 things that students must actually understand, that there is no currency in getting complacent. So we know the day we graduate from medical college is the maximum knowledge we will ever have by way of book knowledge and by our clinical experience, what we learned in medical college. Add experience to it and we get smarter and smarter. But if we do not renew our knowledge, that experience plus the knowledge we got in medical college will plateau, and it will last for a few years, and then we will fall off the bed, and then we will become mediocre. So we have to remind everybody, and I am a board certified in surgery and cardiothoracic surgery from the US, and I still take my exams every 10 years. My certificate is recertified every 10 years. So that's the kind of thing that we need to introduce in our education system. That just because you became a doctor does not mean that you can be doing service to community forever with what you learned in medical college. So I think that's one thing I would like to introduce in our curriculum. I mean, it's a national issue, but I have suggested it to the health ministry also, that renewal of knowledge must take place. That pressure must be on all doctors. Second is the fact that they must have humanities as a huge part of their training. So compassion is actually not taught, neither in school nor in medical college. So because being doctor is just not being able to do your job well, but also to actually be able to contribute to society and the sensitivity that you need to show for patients who are suffering. So I remind people that our colleagues that, look, we are not the suffering guys. They are the suffering guys. They can never be unreasonable because their unreasonableness comes from anxiety. So these are the kind of things, if they are being taught now, and maybe that's already there, but if it isn't, I would like to say that that's what we need to do. The other thing, third, is a innovation. That we do not actually inculcate the value of innovation in our daily life. And we have, other people from outside will come and innovate, but we are the ones who are experiencing on a daily basis, but we don't have time or thought process or training to say, how can I do it better? And that's exactly when I was lecturing in Calcutta at the IIT on technology in medicine. And I did my lecture, but after me came a professor from UK. And he said, each one of you who's graduating from this class is thinking of only one thing, that you want to be a unicorn. And he said unicorns were not made by, any of the unicorns are not made by geniuses. They are not made by the smartest people on earth. But there are people who, and he said, I will suggest what you should do is take one day of the week, from the moment you open your eyes to the moment you close your eyes that day, write down every activity that you did. For the rest of the week, you ponder upon how you could do each one of those activities better than you did it on Monday. And the bulb will flash. If you look at Uber, it was that guy who was standing on the curbside in New York City looking for a cab from 4 to 6. In the evening, you can't find a cab in Manhattan. And he came up with the brilliant idea of Uber. So all innovation has been like that. This trigger has have to happen. But you miss that trigger, it won't happen. So I think these are the kind of things we can, rather than learning it in life later on, if we can inculcate these things at the nascent stage when they are actually open to ideas, education, and influencing by us teachers. So I think that's something that I can say I have nothing else to add except what you have already shown to us in your plans for the future. And medicine is just starting in India. We really are scratching the surface, and the doctors must be encouraged that they can do well, they can be proud of themselves, and actually be such important leaders in society. And doing that also, you are comfortable that you will get enough money. Don't chase it. It'll come to you if you're exceptional. So I think that these are the values that I can share with you. I was at NYU, I trained there, then they asked me to join the faculty, and then I had this bug in my head always that I want to bring cardiac sciences back to India. And you know the rest of this journey, most people know that I built Escorts Heart Institute. That's when I understood that single specialty hospital cannot give you the best across all specialties. So we needed the Cleveland Clinic of the East. That's how Medanta, the medicine in Gurgaon, was built. And then what triggered me was that I was lecturing at Harvard Business School once. And one of the speakers, an American, who was also lecturing there, this was an India forum, and he said that India has 5 Bimaru states. I'd never heard the word Bimaru because I was in the US already for 15 years. And then he named the Bimaru states. And I said, when we come back, I'm going to build equivalent of Cleveland Clinic in every Bimaru state. So that's how Gurugram started. That's how Lucknow started. That's how Patna started. Patna is already opened. We already have hospitals in Ranchi and in Indore. So my 5 states are covered, and now we are building in Noida. So I think that there is a lot of thinking that can be inculcated beyond medicine into our students. And I think that's our responsibility as teachers and faculty members. Thank you.
He needs to be unmuted. Professor Bone needs to be unmuted.
Professor Bowen, can you hear us? Before we move ahead, there are a couple of questions for you.
Sure.
Very good evening, sir. I'm Dr. Rishi Sethi. I happen to be a cardiologist. And myself and we all were really thrilled by your presentation describing the role of laser in various fields of medicine. Although we have not yet acquired laser in our department for the use in cardiology, but we are very close to acquiring that. And looking at your association in your work with multiple universities and importantly, Aligarh Muslim University, do you think there would be, on a selfish note, a chance for us to collaborate with your institute and or your mentoring, or to receive your mentoring in terms of the future of clinical research in laser in cardiology that we might, envisage? Because there is very little data on the use of laser in coronary, although we are all convinced by its utility and efficacy.
Yeah, well, let me say, first of all, I'm retired from clinical practice now. So in terms of a formal collaboration on clinical things, that's not realistic. But on the other hand, I'm certainly keeping activity in a range of research projects involving lasers, involving photodynamic therapy. And in terms of discussing future projects and being a sort of advisor or collaborator on projects you're running, if suitable projects come around, then I would be very happy to do that. I should just say, on the vascular project we did, we've done quite a lot of work on that. And obviously I was only spent 2 minutes on it this afternoon. But it strikes me as very exciting. And if a university like yours was interested in developing PDT for preventing restenosis and saving yourself the cost of many, many stents, then I would be very keen to collaborate on that. But obviously I'm not a cardiologist or a vascular surgeon, but I do understand the biology very well. And I'd be very happy to talk with you in more detail. Possibly what it could do is send you a list of our publications in that field, and then you can see what we've done. Now, it was all done quite a few years ago, in fact, 20 years ago, but nobody has really picked it up since. And I've always personally thought that's a great shame. So if you were interested, it'd be great to talk to you.
Thank you for your kindness, sir. We will reach out to you when such a situation arises. Thank you, sir.
Professor Trehan, there is one question for you too.
Professor Trehan, this is General Puri. I just wanted to thank you for a wonderful some teachings of a lifetime, I think, which are so important for the new generation. And I really subscribe to what you said, that we have to continue to evolve, grow, adapt with technology, and I sincerely believe that should be the way to go. This faculty growth for certification, I think, is absolutely brilliant. We've been talking about it, but I think it requires to come from the regulatory bodies. And the regulatory bodies, just like perhaps they do it in US, I think it should become a mandate. It would improve the quality of care at all levels. And I sincerely believe that coming from you, sir, I think it will be important, because we, of course, will have been putting across this point, but coming from you would make a huge difference at a larger level. I thought I'll just make a small comment about compassion, the point that you made about compassion and ethics, which is so important, so integral, and so important for us as doctors. Just to share with you, we have started a process of taking patient feedback. Besides other feedbacks, we started taking a process of taking patient feedback. We have more than 1 lakh feedback evaluation sheets available with us now, which are actually available on e-hospital, and it is out in the open forum in public domain. The common problem is what you mentioned. There is lack of that connect of the doctor with the patient, and perhaps that empathy, and that is what you mentioned. And I couldn't agree with you more when you highlighted this point, and that a connect, an empathy, a feeling for the patient, I think is so important in today's times. And this was just a comment on that. My last point is about the value of innovation, and we at the college have tried to imbibe this. We have started, as I mentioned, this innovation, to promote innovation, a collaboration with IIT Kanpur to look for technology patents, how we could improve the quality and improve. Towards that extent, we, as you heard, Professor Rishi Sethi is heading the team from KGMU. We have an expert of a panel of in the advisory board. So can I, through this platform, sir, request you also to be a part of this advisory board for this innovative platform that we have started along with IIT Kanpur. I look up to you for your inputs and your support. Professor.
No, it will be my honor. In fact, we worked with IIT Kanpur on developing a portable ventilator at the time of COVID, and now I'm sure it can be refined further and further. So Rishi can pick it up, and I know Rishi, and I'll be honored to serve with on that advisory group anytime you like. Thank you.
Sir, can you hear us, sir?
Yes, yes.
Yes, as we lost your audio a short while ago, sir. I'm sorry, if you could please repeat your last statement.
Okay, so no, I said it will be my honor to serve with the Innovation Advisory Group. And I don't know if you heard that we did work with IIT Kanpur on developing the portable ventilator at COVID times.
Yes.
So it's the prototype can be actually enhanced and taken to another level. And I said, I know Rishi and I'll be happy to participate in whatever way I can.
Thank you so much. Thank you so much. Very grateful, sir.
My honor, my honor.
Thank you so much, sir. Next, we have a message sent by Professor T.C. Goyal, Professor Emeritus, Department of Surgery at the erstwhile KGMC, and a recipient of DSc Honoris Causa in the year 2016. Sir has been an undergraduate and a postgraduate student from this university and was the recipient of the prestigious Hewitt Medal, the highest academic award of this university. A born bibliophile, Sir has authored innumerable medical and non-medical books, including the first textbook of surgery in Hindi. Unfortunately, he could not join us today, so his son, Professor Apul Goyal, will be reading his message for us. Professor Apul, please.
I am Dr. Apul Goyal, son of Emeritus Professor Dr. T.C. Goyal, who was awarded DSc Honoris Causa in the convocation of King George's Medical University held on 29th January 2017. Professor Goyal could not join because of health-related issues. I will be reading his message for this occasion. The traditional core roles of a medical university are medical education, research, and patient care. Before becoming a university, King George's Medical College was known for medical education and patient care. When the college transitioned into a university, an increasing emphasis was paid to medical research. Before sharing my vision about the university, let me first express my feeling of pride and happiness as I witnessed the growth of the university. Even after my superannuation, I have been in constant touch with the university. My relationship with the university is now more than 60 years strong. I have seen the rapid expansion of infrastructure, manpower, and capabilities that has ensured that the national ranking of the university has always remained amongst the top few institutes of the country. I also take this opportunity to thank the organizers, especially the Vice Chancellor, Lieutenant General Dr. Bipin Puri, for giving me the opportunity to share my thoughts about the future path that the university should take. My suggestions for the university are: the strongest pillar of KGMU has always been education, especially undergraduate education. However, because of the mandatory requirement of publications in recruitment and promotion, the pillar of education saw its gradual erosion. It is said by someone, academic physicians are paid to see patients and are promoted for their research. No one cares about teaching. For research, the biggest strength is large number of patients. It is difficult to match the capabilities of the labs doing basic research in advanced countries. Strengthening basic research labs could be a long-term goal, but an easy short-term goal could be patient-based research. For that, all that is needed is good data collection and medical record keeping. With digital technology, this is not difficult or costly. As regards patient care, buying newer and newer instruments and equipment may not be feasible. However, for the sake of resident training and teaching, a balanced approach can be taken. My message is focus on medical education and nurture teachers who teach. If I have to I ask myself as to describe what I am proudest of about KGMU, my answer without doubt would be medical education. Thank you once again for giving me this opportunity.
For your valuable suggestions, especially the ones related to nurturing medical education. Now, as we all know, we are honored to have many other eminent DSc Honoris Causa recipients here with us. And we at KGMU are eagerly waiting for their valuable opinions and inputs. So now we come to the most interesting part of today's deliberations, the much awaited interaction with these illustrious awardees. So as we begin, our first question is for Professor Sudhir Gupta, who is the Professor of Medicine and Chief of Immunology at the University of California and Irvine. Welcome, sir. Professor Hardeep Mehrotra has a question for you.
Sure. Sir, greetings from KGMU Lucknow. So having closely observed both the Indian scenario as well as the global research ecosystem, so how do you compare both these systems, the global versus the Indian ecosystem, in terms of research?
I think the research I put in the category of discovery. I think I don't want to compare the two. What I would like to see at our institution, KGMU, that I think we nurture and really produce the first-class physician scientist, because that's what is needed. We have a lot of good clinical material. What we need is really a first quality of research on different disorders or diseases. So I think we should have a big emphasis on really developing a physician scientist category, because these will be the one that you take the science or the question from the bedside, the bench, and bench to the bedside. And that really further what we will call the care, the healing part of any medical institution, because you have a discovery, you have the healing, you have the teaching. Those are the three important ones. So in this case, you take the healing as well as the discovery to make that a combination. And I think if I have to say, even globally, this is the one species which is disappearing, because in the United States, either you are a clinician or you are a researcher. When we came and we are the physician scientist, that really slowly disappearing, which is a sad situation. But I think it is very needed. And if we can really emphasize that and try to develop those, would be a great thing. And in the same breath, I will say, we have to be very, very truthful and realistic to ourselves. All these Stanford University ranking, they are worthless to, I'll tell you, because I was listed as top 1%, which I don't believe it. So they do all these things, and you will feel so great that your teachers are 2% of the entire world. So I think we have to look inside ourselves and see what we are. And to that aspect, from a research point of view, what I would suggest to you is your faculty, when you take their publication, categorize them according to science citation impact factor. Those below 5, 5 to 10, and 10 above. That will give you the quality of your teachers and physicians and scientists, that where you are, because that's a real reflection of that. The PubMed now started listing even the abstract in the PubMed. So don't go on the PubMed. Again, anybody making their CV or bio data, every faculty should have listed them as a peer-reviewed, invited lectures, invited reviews and book chapters, and the abstract very separately. And that gives you really, in an easy way and a right way to judge your faculty. So I will definitely be critical of ourselves, how we evaluate. So very, very important. Don't just go on because we will feel elated that, oh, we are in 2%. But I think we have to be very realistic. So my message is really not to compare that way, global versus Indian Institute, but we should strive for as better. There are certain standard guidelines based on that we should really aspire and progress. But definitely I can not overemphasize that we should develop a category of great physician scientists.
Very well said, sir. Thank you for the thoughts. Thank you, sir.
Thank you, sir. So I'm Dr. Vimala Venkatesh. I'm a professor in microbiology here at KGMU. So you have actually already partially answered my question, but I still would like to ask, so what are the fundamental changes that you think we should make in our university as a whole to promote and inculcate research culture in our students and in our faculty?
I think you will see in this both, it is the commitment on the part of the administration. B, the teachers. Teachers should be really, they should educate themselves, they should be experienced, and there should be a desire on the part of the students or the resident for that matter. And it is that combination which will be so critical, because you may be a great teacher if that student you have taken under the arm is not interested in it, is not going to pursue it. So it is so important. And also, I think you should take opportunity. For example, it was not mentioned, but I have a foundation for primary immune deficiency. These are the diseases of inborn error of immunity. And we have 8 centers around the country in India. And KGMC is also one of the centers where Dr. Avesti is the director of that. And through, just like to give you the example of this, all these centers at PGI Chandigarh, SGPGI, and you name it, that we provide, if you have a smart fellow or this resident who wants to pursue the career in it, we provide them. We get them to United States. They can spend a couple of months at NIH. We pay all that, and they go back and then use that technology and experience. And that's how you can make it so great. And I think it could be done perhaps in a number of specialty. We are here to help in United States, and I'm sure United Kingdom as well. So take that opportunity so that they can be trained. Even the teachers can come and they could be trained. So we have done that at PGI Chandigarh, in Mumbai, and other places. So I think those should be some of the direction that we should take. And I have no doubt KGMU could become a great, great place. It is good, but it could be better.
Thank you, sir. Thank you. I think we will move along in that direction. Thank you for the suggestions, sir.
Professor Soumendra.
Very good day to you, sir. Continuing in the same vein of the 2 questions that were asked and actually going to their culmination, we were very interested to know how you think KGMU can take the next step forward, the next step ahead in the realm of research and in the realm of more improvement overall.
Yeah, when it comes down to research, at least from my experience in our days, which of course over the time have changed very much, but I still see that when you look at the research for MD and those are given, those are research really something which has been done in the Western world, and let's do for India. That should not be the motive. Your thing should be really what Naresh said, that innovation. It should be unique, that you are thinking something And that's where the mentor or the guide will come, that the guide should think, ask a very important question. And those questions could come from your patients or otherwise, and take that question. It is a unique question. It is not that it has to be done someplace else. So to me, the word discovery is the important thing. And doing something which has been done in the Western world and we do in Indian perspective, that's not a discovery. So to me, that should be the aim as far as when it comes to research. And I think what we have at KGMU and India, we have great mind. I think it is a matter of providing the guidance and opportunities that they could really excel so much. So to me, I think one should start thinking that way. A important critical question. There's no single case, even it could be a run-of-mill diagnosis. Every patient is a little different. And if you think about why this is so with this patient, you will have a question that you can be very innovative in that. So to me, that's so important to take. And I think you are very fortunate to have General Pri at the helm. And I think his support would be so critical, whatever you have to do there. But I think it takes everybody to it. The teachers have to be committed. You guys have to be committed. And I think we are here. So one thing I'll say, all of us who are on this panel at the moment, we are all here to help you to pursue anything you want to do.
Thank you for inspiring us. Thank you, sir.
Thank you so much, sir. Next, one of our senior residents, Dr. Neeti Solanki, has a question for Professor Jatin Shah. Professor Shah, as we know, is the professor of surgery at the Weill Medical College of Cornell University and the Elliott W. Strong Chair in Head and Neck Oncology at Memorial Sloan Kettering Center, New York. Yes, Neeti, if you can come here.
A very good evening to you, sir. Sir, as we all have gathered here today, not only to celebrate the past 75 years of Indian independence, but also to plan for the coming 25 years. So my question to you is, what should be the 5 critical thrust areas for KGMU so as to be the right place after 25 years?
See, as Sudhir pointed out, growth and progress is a continuum. And you don't have one fixed target. The target is always moving ahead. You make a mission for something, accomplish that, and that's not the end of it. 25 years is not the end. And when you get to that point, you move on to the next target. So the targets keep on moving as your curiosity keeps on moving. So I think, what you may want to add in the clinical arena, as Sudhir pointed out in research arena, is perhaps institution of a multidisciplinary disease management teams. And I'm particularly focusing on cancer. No cancer is today being treated by a single specialist, be it surgeon, be it a radiation oncologist or a medical oncologist. It is a disease being treated by multidisciplinary teams. So the focus in developing in clinical arena would be to establish multidisciplinary disease management teams focused at, for example, lung cancer, breast cancer, head and neck cancer, where you have a surgeon, a radiation oncologist, a medical oncologist, pathologist, radiologist, who are members of the team who meet on a regular basis in a tumor board format to not only discuss the current problem, but through that generate ideas for doing clinical research and perhaps even ideas to satisfy your curiosity in basic research. So my suggestion in the clinical arena would be to focus development of disease management teams, and which can be applied to any disease, because all diseases today are being treated in multidisciplinary fashion.
Thank you so much, sir.
A very good evening, sir. I'm Dr. Anju Agarwal, professor in Obs and Gynae. And in continuation of your answer, I would just like to request you to identify which are the 5 important clinical specialties which you feel KGMU should be focusing on and developing into areas of excellence to stand the test of time in the coming 25 years.
I don't quite get your question.
Sir, I was asking about 5 important clinical specialties on which KGMU should focus into developing into areas of excellence.
Yeah, but as the Vice Chancellor pointed out, the numbers at your institutions are mind-boggling. And singling out one specialty would be clearly impractical. I think we need to develop or focus on every single disease specialty, because you have the manpower, you have the physical plant, you have the resources, you have the faculty. So it's not just GYN or head and neck or thoracic tumors or diseases, but it should be in every facet. The concept should be philosophically, the institution now is going to focus on disease-based teams rather than treatment-based teams. Up until now, we have been practicing medicine based on therapy. Surgery, so we have a department of surgery, we have a department of medicine, we have a department of radiation oncology. But that is archaic. We should have disease-focused teams because all diseases require input from multiple specialists to address the issue. So my suggestion would be that as an institution, perhaps a policy decision could be made to not do away with specialty-based departments and divisions, but focus on disease-based teams, disease-based divisions, where you have multiple departmental inputs. You may report to your current department chairman for your academic growth and activity and your salary and your elevation in academic stature. But when it comes to clinical care, you are responsible to the disease management team and not your department chairman.
Thank you, sir.
May I suggest something?
Yes.
This is Dr. Rama, may I suggest something? One thing which we have not touched is mental health. This is the area which we all need to focus more, because right now we are just doing psychopharmacology and we don't have much knowledge about how to do the mental health. It is a stigma. And I think that General Puri should also consider having something to do and expand on the mental health issues. In this country here, they have developed like 911 for emergency, now 988. They can call for the mental health issues or something. So that would be my suggestion. And may I digress for a minute? And General Puri, excellent presentation. One area that you may consider adding is the global health and exchange program. And we have, like Professor Himanshu Reddy came here, Professor Arun Chaturvedi, Professor D.K. Gupta, and we have brought medical students to King George's Medical School for last 10, 15 years, and they have benefited. So exchange program has been very good, and hospitality of KGMU has been exceptional. So maybe Professor Reddy can expand on that one.
Yeah, thank you, sir. And very good afternoon. And also some ma'am sitting there. Please be sure from my side. It's a pleasure always to see her. Yes, sir, we have had a very good MOUs and networking, global networking and interactive exchange programs. And we are looking forward to actually improve and increase on that. We started off with the infectious disease interactive session where your students came here and our students had the benefit of interacting with them, and they understood how things are done in US and where we should improve on. Plus, they also understood the foreign students understood our strengths that included the patient care, the clinical material, and the way we do the bedside teachings. As pointed out by Professor Gupta and Professor Shah, I think that interaction has actually made us understand that our strengths are the bedside teaching and our medical education, which actually has to be incorporated with the idea of research, along with making teams so that we are able to take up from there. We should not leave our strength. And I think having further interactive and exchange programs with maybe developing with other institutes, as Professor Gupta said, would help us making a global institution on the long run. Thank you, sir.
I don't think I said you have to leave the clinical. Remember, a physician scientist, the clinical part is integral part of it. And for us, all of Georgian who are abroad, I can tell you one of the things which are always proud of our clinical training. We are such a great clinician that no other institution can match, I can tell you.
I think I want to add something else. The place where I work, Memorial Sloan Kettering Cancer Center in New York, is opening a satellite in India next week, as a matter of fact. The mission of this satellite is not only just patient care, second opinion services, but more importantly, education and research, collaborative education activities and research. And to that end, we have been conducting joint tumor boards as a step one towards the education process with major institutions in India. During the course of the current year, we had a tumor board with All India Institute on thyroid cancer, with Tata Memorial Hospital on oral cancer, with the CGH Cancer Center in Ahmedabad on salivary tumors. The last one we had was with Amrita Institute in Kochi on skull-based tumors. And we have an upcoming tumor board with the Cancer Institute in Adyar in September. So I would welcome to have a joint tumor board with KGMC. If you folks are interested, I would be happy to communicate with the person you designate, and we can organize that joint tumor board as a first step towards establishing joint educational activities.
Thank you,
Can
sir.
I make a couple of comments?
So, and we would be very interested.
I think I would want to make a small endorsement here, Professor Jatin, in case, we would be absolutely delighted if in the course of this tumor board meetings, if KGMU could also be involved in this tumor board meetings. And I think already we have 16 specialities which have joined up for the tumor board, besides, of course, medical oncology, surgical oncology, and radiotherapy. There are so many more departments which are all joined up. We're all doing oncology, and they've all joined up and come together in these tumor board meetings, which we do once a week. Having said that, it will be an absolute delight to synergize, coordinate, and take some advice. And with the Sloan Kettering, it will be just a wonderful exercise.
So you have my email, designate a person as a liaison, and we will communicate and agree upon organizing a tumor board towards the end of the year this year.
Yes, sir. Thank you so much. Thank you so much.
Thank you, sir.
Yes,
sir. Yes, please.
Please go ahead, sir. Please go ahead.
Yeah, can I add, first of all, how much I appreciate what Professor Gupta and Professor Shah say about focusing on a disease rather than a specialty, bringing people together. But I would like to suggest that it's worth taking that further. You need to bring scientists into that. I lament the lack of physician scientists, but it's a different sort of person than the person who wants to spend their life basically treating patients. But when you do find people like that, then you need to integrate them with the pure scientists and the pure clinicians, bring them all together, and people who, well, clinicians who already have some training in another science, whether it's physics or chemistry or anything else, they, I feel, sometimes achieve the most because they can think from two different directions. So I would say if you want more of that to happen, one really needs to fund people to do the science. So you fund part of the time of clinicians so that it is a duty of that. Because I know in the US, I would discuss jobs over that some years ago, and I found that what I was being offered was they would pay me nothing for doing the research, and they would expect me to earn my salary by treating patients. And that was just completely unacceptable to the sort of career I had in mind. But I'm saying you want to put more resource into the science side of clinician physicians. My job for 30 years was 50% looking after patients and 50% research. And that often overlapped with specialties outside my own, like some of the things I showed you earlier this afternoon. But to say we need to integrate teams with different levels of experience, not so much levels, but different areas of expertise, whether it's other clinicians like surgeons, physicians, radiologists, pathologists, etc., or whether it's bringing other scientists in as well. And a lot of the clinical developments in the last few years have been related to technology. The scientists give them equipment and the clinicians work out how to use it, and they work together to optimize the therapeutic applications.
Professor Brown, let me comment. That's a minority of the thing. If they are hiring you purely as a clinician, then only you have to earn that money. I've been here for 50 years on faculty. I do 80% research, only 20% of the clinical, and I have not to bring any money generate myself. So that's only if they are hiring you. And whenever you are coming from abroad, you cannot apply for the grant, you can't, because NIH has the rules and all those. So it's very different when you are, if they are hiring you as a pure clinician. So that's how in the United States it works. If you are coming as a pure clinician, majority of the time they will ask you to generate your salary. But as far as otherwise, and I'm a perfect example of a physician scientist, I think Jatin is the same way, he does the surgery, but he does a great research, received a lot of awards. So we do that way. And I think in India, we can do it in our KGMU the similar way.
Yes, of course, there's always the grant option. And I've been involved in various grants, which basically come from the US government. So I appreciate that's the other way of funding the research. But I would think if you want to develop the physician scientist world, perhaps the universities should look seriously at funding ongoing established posts where the physician is spending time on the science.
Could I come in if you allow me to?
So please go ahead, sir. Please go ahead.
Well, yeah, I mean, it has been a fascinating evening or afternoon. Thank you very much for inviting me to join this distinguished group. A couple of things which I think are very obvious from this discussion. First of all, I must express my sincere thanks to Professor and for giving me the opportunity for advising and helping the Center for Precision Medicine and Healthcare, which is actually the future. I think the question was asked to me by Professor Rishi Sethi about the future of KGMU in next 25 years. And that's one area of, I think,
development that needs to be focused. It is tied up with innovation. It is tied with the research and development. It is tied up eventually helping what we call the multidisciplinary omics. That is the catchphrase now for the future. Omics, some of you might know, it is a catchphrase for many different branches of science. And genomics is, of course, a leader in that group. And that is the future of medicine. And I take it that's where I think the disease management should be, which Professor Shah has pointed out. And that's where some of the centers are developing here in the UK, and of course in the USA as well. The multidisciplinary omics is a key phrase for future medicine. And that's the area I suggest KGMU Lucknow should focus on. And it will give you many opportunities for research and development, many opportunities for innovations, which the word innovation has been coined by Dr. Rehan. And I'm very pleased Dr. Sethi is already involved with his work with IIT Kanpur. So that is one area I think I would suggest, and I've already mentioned that. Second one, which I think is very important, Professor Surinder Verma mentioned, and that is the global health. And I've been very fortunate to be involved with the WHO program of the WHO Science Council. If I can just take the moment to show this. This is my sort of vision for the KGMU. I put down 25 years, 2047. So we need to have a strong platform for digital health, as you can see from here. That will be interactive healthcare, the electronic medical records, interacting with the direct patient, personalized healthcare, all the safety information, and then the precision medicine will be helping that, and research and development, innovation, and above all, the community and public population health, which will of course provide information, up-to-date information for communicable diseases. As we suffered during COVID, we did not have enough information, and that delayed the recovery. So if we start working, we're already working, I'm very pleased, many departments are already working, many projects and then eventually we will go into that direction. And the most important thing about the extensive medical education, and I take this point about the revalidation, about the continuous education. That's what we are doing in the UK. Every 5 years, we have to revalidate with the General Medical Council or General Nursing Council for our license. And in America, they have got every 10-year recertification program. So we have to, I think, the controlling bodies, the watchdog bodies has to really take into account this thing. And above all, finally, the integrated healthcare and research development I have mentioned. One thing which I would like to point out, I mentioned about the WHO, and I've been very fortunate to be involved, invited by Professor Soumya Swaminathan. She's also one of the DSC Honoris Cause holder of KGMU. And this is the future of global health based on genomics. And essentially, this program was created as a future preparedness for next pandemic. And all of us, we took part. My input in this, these deliberations was purely on the education, mainly skills and competencies, which has been highlighted by many speakers today. And of course, the word ethical and social issues are also central. And I take it what Dr. Verma mentioned about the mental health, that also came up in discussion during this. So KGMU should look at this document very carefully, very closely, and develop the dedicated pilot research project so that we are also in line with the WHO recommendations. And this is the white paper which is going to be presented to the Assembly, and hopefully it will be passed on to member states. So I think that I will certainly be very pleased to take part in any future development. I'm already helping the precision medicine healthcare development as an advisor.
Yeah.
This is my sort of message for the next 25 years. So thank you very much. I think.
Thank you so much. Thank you so much, Professor Davendra Kumar. Sir is an honorary clinical professor and clinical geneticist at the William Harvey Research Institute, Bath, and the London School of Medicine and Dentistry, Queen Mary, University of London, UK. Sir, we have all witnessed your passion for genetics and genomics, and we are actually very, very thankful to you for your wonderful contribution in starting the elective in genetics at this university. Next, we have a question for Professor Surendra Verma, who is the Executive Associate Dean for GME and Resident Affairs and a Professor of Pediatrics at Texas Tech University Health Science Center, USA. Professor Anita is interested in asking you a question, sir.
Good evening, ma'am. Good evening, sir. Sir, with your vast experience of Dean of the Graduate Medical Education at the Texas Tech University, what would you suggest as fundamental changes or improvements in our university curriculum or the pedagogical methods which we are dealing with teaching and training in order to produce the undergraduates and postgraduates which are suited for the global market? Sir.
Yeah, I think that we have to have balance as well as science. And I am a little skeptical, like Sudhir said earlier, that when we do our MD, we have to do the research and it is more rehash. So we should look carefully that is it necessary? I think instead of that, focus on more on your medical education and compassion, and as well as also that things which are not available across the street. You have postgraduate institute, we can collaborate with them, and also pay attention in pediatric to like their, I think, mental health. I think these days, I think that autism is very, very common now. Second, I think that we do not pay much focus on the well-being of children. Teenage suicide is increasing. We have to look into this, prevent how we can prevent these things. I'm not a psychiatrist, so don't think that I am promoting that. No, I am a pediatric endocrinologist, but this is what I think that this is the future we have to look for the children. And I am very honored that we have established a gold medal in pediatrics since 2012, given to the best student in pediatrics. So this is our humble contribution.
Thank you so much, sir.
Thank you so much, sir.
Thank you.
If I could just expand on that, what Dr. Verma said, I think autism is so much under-recognized in India. I have a fortune to do some research on it in the last 10 years, even though I'm not a neurologist or psychiatrist, but more from an immunological point of view, because there are both genetic and immunological component in this disorder. But it has become, at least in the United States, extremely common, perhaps the commonest of the pediatric disorder. But I think in India, there are a lot of them. And it is a matter of recognition, because I have some of the patients in Mumbai that I follow. So it may be a good area to introduce at KGMU.
Thank you so much, sir. Our next query is to Dr. Trehan. So, Dr. Trehan, are you there?
I doubt very much.
Yeah. I think he left probably.
So I would now request our Vice Chancellor, sir, to say a few words before we wind up finally.
Yes, so thank you, Professor Amita. Thank you, gentlemen, for being there for us for KGMU this evening. Professor Stephen Baum for this for a wonderful exposition on lasers in medicine. I think it was absolutely a very, very fascinating, and I think we have not used lasers in such diverse fields as Professor Baum mentioned, and I think there is a need for us to do more of clinical and research as far as this is concerned. My only observation here was, and this is an observation which is shared by some colleagues and friends, that sometimes it becomes difficult to control the depth of the dissipation of energy when we use lasers, and that perhaps is one such limiting factor. And I would want Professor Baum to comment on this factor, on this point in subsequently. As far as my other comment was, of course, Professor Naresh Trehan brought out very important points that we require to continue to evolve and grow and adapt with technology, and faculty growth and certification of the faculty will continue to be a very, very important part. And I'm sure in times to come, regulatory bodies in India would understand the importance of this. The other thing, Professor Sudhir Gupta, I was compelled to think about what he said and to introspect and critically analyze where you actually stand, and not go up in laurels about your, and try and introspect about your publications, your research, etc., etc. And the concept of the physician scientist, I think it's very important, especially in institutions like ours, academic institutions where we teach even the undergrads. At the undergrad level, we are teaching them to get into basic research, and that is, I think, that really would be a very important step to give this an impetus. Sir, at this point, I would want to emphasize, in case it's possible, for this exchange program like we have with Professor Suren Verma, in case we could have an exchange program with the NIH, with your institute, it will be for KGMU, it will be a great pleasure. We could choose and pick the right students, the residents, the faculty, junior faculty who would benefit from this exchange program, and I would look up to you for your support for this exchange program. Sir, if I may just complete, Professor Jatin Shah, thank you so much, sir, for what you talked about, that growth and progress is a continuum, and I couldn't agree with you more. As far as that is concerned, multidisciplinary management teams are integral in the management of cancer, and I think it's so important that and thank you so much for helping us and making KGMU a part of the tumor board proceedings in the time to come. We would connect with you in due course and would look up to you for your blessings on that score. Professor Suren Verma, sir, thank you so much for your suggestion. Yes, mental health indeed will continue to be a very, very important part. Yes, we may not have given as much as emphasis as that. The fact of the matter is, even after COVID, we saw post-COVID, the amount of stress disorders that we've been seeing is unbelievable. And that is one major issue. But also, just to keep share with you, sir, that the Department of Psychiatry has started a couple of innovations as far as mental health is concerned. One of them being a district early intervention center where they have, building up sensory gardens for early intervention in picking up mental disabilities. Now that's something which is new, which has been started in the psychiatry department. Besides, of course, substance abuse, de-addiction clinics, and opioid substitution therapy. These are specialized centers which have come up in our psychiatry center. But I could not agree with you more that I think there is a need for us, a growing need to look at mental health as integrating it with physical health as far as this is concerned. And Professor Dhavendra, of course, has been has been very actively involved in this precision medicine, setting up the precision medicine at KGMU, and he was here with us last year, and we're looking forward to his visit once again this year as well. And as we are privileged to have an elective for our undergrads on genomic medicine. And I thank you once again, Professor Dhavendra, for helping us in this endeavor for indoctrinating genomics into the young medical school children. I think it's a fantastic idea. And once again, it's a privilege to have Georgians of this stature who are across the globe, who are now in such positions of excellence, where we, as the alma mater, your college, your medical school, children in today's generation can take help and benefit from your knowledge and your expertise. So with this, a few words once again. Thank you so very much. But if there are any comments from our expert panel, we'll be absolutely delighted to take them now.
I will see you November 29th. I think Shali Avasti is arranging it. So
yes, sir. So we would continue with this exchange program. Thank you so very much. Thank you so much.
So with this, we come to the end of this illuminating and one of its kind meeting. We've all been a witness to a very insightful discussion, and our experts and dignitaries who have joined us have provided such pertinent suggestions. I'm sure this will aid us in chalking the way forward. And now I invite Professor Rishi Sethi, the main coordinator for this meeting, to deliver the vote of thanks.
Well, as we reach the end of this very interesting and fantastic meeting, it is my pleasure and my duty to propose a thanks. In the life cycle of any institution, or for that matter, any individual, there comes a time when we have to pause, reflect upon the yesteryears, and meditate upon the path ahead. In the 76th year of India's independence, under the single-handed vision and leadership of our Honorable Vice Chancellor, Sir, Lieutenant General Puri, and with the blessings of our Honorable Chancellor, Madam Governor of Uttar Pradesh, Srimati Anandiben Patel, it was decided that King George's Medical University should formulate a vision statement for next 25 years. Our Honorable Vice Chancellor, Sir, conceived the idea that the best advice in this regard can be given by the highly distinguished group of all previous recipients of BSc Honoris Cause of this university. Today's evening had been curated around that idea. I thank our Honorable Chancellor, Madam, our Honorable Vice Chancellor, Sir, for this opportunity that brought all of us together. BSc Honoris Causa is the highest degree of recognition a university can accord to any individual, and all 24 previous recipients have been legends in their own right. Many of you have joined us today evening, and we thank all of you, Dr. Trehan, Professor Bowen, Dr. Shah, Dr. Dhavendra Kumar, Dr. Sudhir Gupta, Dr. Verma, from the core of our heart for agreeing for this meeting at such a short notice. I thank all the deans, head of departments, faculty members, students who have joined us today evening, both on site and in virtual mode. We also thank Team Echo India, especially Dr. Kumud Roy and his team, for helping us in the logistics of today evening. Saving the best for the last, I would like to introduce the core team that helped us put this evening together. Thank you, Dr. Amita Pandey, ma'am. Thank you, Swamit Singh, Dr. Richa Khanna, Dr. Akshay Anand, for all your help and cooperation in this regard. Finally, on behalf of our Honorable Vice Chancellor at the University, I would again like to express my deepest sense of gratitude to all our distinguished recipients of DSc Honoris Causa, our esteemed guests for today evening, for the time and their words of wisdom. All of us feel enriched today. We have added value to ourselves by your presence, and we hope to carry your words of wisdom into practicality in times to come. Wishing you all a great evening and a great weekend ahead. Good night. Jai Hind.
Thank you once again. Thank you, gentlemen. Thank you very much for being with us this evening.